So there you have it. We need to get people doing cool mental health in urban places research to tell everybody about it. We need to get designing our land spaces so that we have pets in our houses and social spaces to convene with each other. We need to prescribe parks for kids. We need to take good hospital ideas and put them out there in the city. Get some cool apps that figure out what works in urban design, and design streets for people. Here's our ideas for this evening. I see that it's now at 7:25 and some of you might be getting thirsty, so I'm going to inquire of my lovely research associates to go back to the bar, and if people want a drink, do, but in the interim, we have questions. You can sneak and have drinks during the questions. Vigorous question there. You can ask to all or any. Whitney, yes.
Hi, Whitney Austin Gray, I work for the Well Building. Hi everyone, Whitney Austin Gray, I work for the Well Building Institute. So thank you, this is a jam-packed panel. Honored to be here. So I kind of wanted to have an observation to have you guys kind of respond to. So in public health, and I come from that field, we do a lot of victim blaming, so it's all about the person they need to change. And I think the built environment health space is more about the community and social support. I think in particular that needs to be brought out in the mental health conversation, that it's not a person who's depressed, it's a community who can be supported better through social interactions. So I'm kind of battling with that myself, around like how do you talk about this sort of, I don't know, maybe we've gone from infectious disease to chronic disease to what I like to think is almost like a social disease, social health kind of component of how spaces support community that support health. Clearly this is a work in progress hypothesis of mine, but I'm kind of curious when we talk about mental health and social support and spaces, if you have some kind of comments or reactions to that.
Anyone want to say anything? Or while you're musing upon it, I will say that I absolutely agree with you. I think that what's really interesting when you're looking at this field is that you are looking at, this is population health, this is not individual, one person's depressed, how can I change the park outside to make them less depressed? I mean, sure, that could be part of the solution, but really what we're talking here is how can we make the place in which people live conducive to lifting all the boats in the sea, if you know what I mean. I don't know whether I'm talking any sense at all, so would somebody else say something sensible?
Sure, I mean, it makes sense that, I guess we don't need this, it makes sense if you're not going to concentrate on the individual, that the things a city can do lift everybody up, and then hopefully that lifts people that have a predisposition to mental health issues also. And so if you can do the big things, like the parks, and if you can do the big things, like turning the street system upside down so that it favors walking and biking and transit, if you do those big things, then you're going to reach more people. Is that where you were going?
Maybe I can add this just a little bit. I guess it's an open question for people, but when we talk about design and health and talk about community design, you can affect multiple people. And it's not about affecting the one person with depression, because we're still clinically looking at Joey who has an issue with obesity, right? We're not looking at how Joey needs to be in a community full of other people with him that can support that he play outside too. I think the conversation around mental health and community and social connection is really important, and social health and connectivity, a lot around connectivity, and it's not discussed enough. I think the realm of mental health and design really offers an opportunity to speak beyond individual health to community health and social interaction.
I think it's spoken about quite a bit in the context as a social epidemiologist. I'm an epidemiologist who brings in sociology, medical sociology. And in our world of research, we talk about it a lot. We talk about, well, when we talk about context, most of the work, the research we've done, and my colleagues do, is at the individual level. So if you talk about gene-environment interaction, or gene-environment play, you're looking at the individual context. But more broadly, social epidemiologists say, well, you know, we need to, using the Urie Brenner model of social ecology, you need to bring in the broader context. So it's the individual within the family, within the community, within the social structure, within the broader environment and the larger geopolitical sphere. So in that context, it's talked a lot about. And in my writings and in my research, I've done and collaborated a lot of that. What's missing, which is why I'm collaborating with the geographers, is that geospatial context. It's the built, we talk about the built environment a lot in epidemiology, but most of my epidemiology colleagues don't know really what that means. So we need to talk to people like urban planners and people who know what that means at multiple levels, not just at the individual level. So the dialogue is really pushing out. And part of my shtick is connecting with urban planners, connecting with physical geographers, connecting with health geographers, who can tell me, how do we bring this into the research? At NIH, we don't talk about this. It's not real. So, so it's bifurcated. We have these silos in research, and it's one of the ways in which we can, public health can help infiltrate and cross-fertilize. It's very important.
Yeah, I just wanted to reflect on your reflection, because as you were saying that, I was just thinking that, you know, we do talk a lot about planning and designing for vulnerable populations, and typically we talk about low-income communities, communities of color, and I don't think that there's been enough discussed on, you know, populations that have mental health issues. I was just thinking, like, I lived in San Francisco for a little while, and I lived right next door to an SRO, and it was sort of clear the people that hung out, single room occupancy, like housing situation, people that had mental illness, and there were, you know, people just hung out outside, and I could hear them like in my bedroom, and you know, like there are services in that city. It's probably one of the best in the country, but I don't think that we're doing enough, like collectively, to address the issues that people have. I mean, it's great that they had housing options in San Francisco. I don't know if that's true here. I think that also gets us then into issues of homelessness. I mean, yeah, I think like your observation was right. It's just a hard issue, and we need a lot more research.
Hi, I'm Tina McIntosh with Active Bodyworks. We create active spaces and teach people how to use their bodies. Well, my question is that when we're talking about the mental side of this, I'm really confused because that's so broad. And so part of my brain is just shut down because I'm like, okay, what does that mean about depression and all the true mental sides that I know I have no level of expertise on? And then when we just talk about something like stress reduction in the built environment, how does that all pull together? Because I know I want to run away from this because it's not even where I'm even close to. But I know that physical activity can actually play a huge role in the reduction on so many levels. How does that all pull together from the extreme side to the light side?
Yeah, I mean, I think this is really challenging because, of course, mental health in itself is a huge area. There's lots of people working in the space that they sort of call happiness. And as a psychiatrist, I'm not really one for happiness. I mean, as a person, I want happiness. Delight me with your beautiful designs as I walk down the street. But I think that in the context of this particular initiative, we're going to be looking specifically at mental disorders like depression and schizophrenia and dementia and potentially ADHD and maybe a couple of others. And we're going to be looking at the determinants of those, and we don't know exactly where we're going yet because, in fact, there has been some good summaries of the research, but it's really just a drop in the ocean. So at the moment, we're not here tonight to say this is what you should do to improve people's mental health in urban design, because this is a huge subject area. And I think that what we're doing first is we've got 5 excellent research associates who are going to be working all this summer to bring together all the research that we can find. And then we're going to have to narrow down some of our focus areas, but I want to wait to see where the opportunities are and to see where the need is greatest to understand where best to focus this. You're right, it's a bit intimidating because it's so big, but I think that is also really great because there's so many different angles that people can come at this, and everybody's working in different fields, but there's something that we can all do. And you know, I'm looking at this and I'm thinking, all this random research is everywhere, I'm finding this really complicated. And what I want us to do is to try to figure out some practical, evidence-based, sensible recommendations that people can say, oh, okay, I could actually get on board with that and start implementing it. And I don't know how practical that's going to be, but that is the plan.
My question comes from the municipal government perspective. I work for the DC government. And I'm curious, when we think about pushing this agenda forward and really creating sustainable solutions, in thinking about creating a community conversation? And when we do, does it make more sense to push strongly on highlighting the mental health benefits and aspects, or on the practical solutions that may happen to have those happen, but not actually pushing that agenda as strongly? So we want outcomes. In the end, we want everyone to understand the outcomes are good for mental health, but will that detract from getting to solutions that will actually benefit mental health?
Someone want to take this?
Sure. I can use this, maybe. Economic development usually is the best driver of anything you want to do in local government. If you can say that it's going to bring a return on investment, everyone from the business community to the people in the neighborhood are going to start paying attention. I mean, that's got to be the first thing that people look at. And in a DOT, if we're thinking about a walkable environment, a bikeable environment, putting in new transit, that's where we come at it from. A lot of the mental health stuff that we've started seeing in the last couple of years has really been just an add-on. But as the research gets stronger, I think you can push that.
Any other thoughts from the panel?
You know, we've been talking a lot about public health. I think population versus individual. And you know, I'm in medicine. I also wear a public health hat too. And I actually find that in practicing medicine, it's sort of a window into these much larger issues, frankly. So one of the things that I do in the office, I try to make time to do, is do like these activity logs. And I ask, you know, Jose or Arturo or somebody, what do you do all day? You wake up, between the wake up and the go to bed, what do you do? And I am aghast every day when I hear what they do. They almost never go outside, and they're on this pretty much 24/7. They can barely hold a conversation anymore. It's amazing to me. And something happened in the last year or so in my community, which is almost entirely immigrant community of color, poor. I walk into the rooms now, and everybody is on one of these. The kids, I'm saying, they're playing games, they're watching videos. I can barely concentrate when I'm trying to write a note anymore. There's constant noise pollution. They're constantly stimulated by this sort of artificial screen. And you know, for me, you ask, like, what can we do? I mean, I think the research agenda should be also thinking very, very carefully about how does this affect our life, right? And how is this a barrier to our living a normal life anymore? I mean, these are kids and parents who spend 90+% of their time indoors, either asleep or awake, on some kind of virtual media, something or other.
I'm going to pretend that's not me.